I remember first reading Irvin Welsh's Trainspotting when I was 15 years old, and it was a brutal, almost visceral experience, in fact. His darkly comic collection of stories, focusing on a group of friends in Edinburgh in the 1980s, well, it revealed to a wider audience the horrors that heroin can inflict. And frankly, since that time, my homeland has struggled to deal with drug addiction and its consequences. Whilst the new set of official figures do show a marked decrease, Scotland still has more drug deaths per capita than any other country in Europe. I'm Niall Paterson, and in this edition of The Daily, we'll be asking why. A little later, we will be speaking to a substance misuse expert and Irvin Welsh himself, but we start with our Scotland correspondent, Connor Gillies. Connor, take us through the figures. A reduction in drug-related deaths, but it's still a pretty grim picture, isn't it?
It's certainly not one for any cries of victory in all of this. 1,051 people died in 2022, which is a drop of about 279 deaths on the year before. So that is significant because let's remember Scotland has had a spiralling, a staggering rise in deaths, really for more than a decade now. It really took off in 2013 where the loss of life went through the roof. So yes, there has been a drop, but let's put it in context. If we look back at 1996, that's when the official figures began being gathered. Deaths in that year were just 244 people, 244 too many, but it just shows you the really troubling period that Scotland has gone through to this journey today.
Looking at the data, 1,051, equivalent to 3 people dying every day, the highest rate of any country in Europe, including the rest of Great Britain. Can we be specific about who is dying and where they are dying in the country?
It's a really mixed picture, and it hasn't really changed over the course of the last number of years. Glasgow, where I am here just now, has had a notorious problem when it comes to drug use, substance misuse. But Dundee has also had its part to play over the last 5 or 6 years. The age groups tends to be usually men in their 40s and 50s who have been losing their lives. But we also have been seeing last year, again this year, a sustained rise in the loss of life among women. We've been trying to ask questions about why that trend may be happening. Some of the experts that we've been chatting to, some of the campaigners, have suggested that women are less likely to try and approach services that may help them get out of their cycle of addiction because they may be in a life of trauma, a life of abuse, and going into these centres where they can seek that help is more tricky because they may have come from a life of domestic abuse, and clearly they will be surrounded by a lot of men in those places. So the trends are very similar over the course of the last year, but the overall figures are coming down. Now, campaigners would say that's no thanks in full to the Scottish Government's investment, millions of pounds over the last couple of years. There's still a slow pace, and let's remember there's still more than 1,000 people dying, the highest rate in Europe, much higher than the rest of the UK, and that is a shameful, shameful record.
Connor, what have the Scottish Government been saying about all this? I could recall Nicola Sturgeon, former First Minister, saying that previously they had taken their eyes off the ball, but what about the current law? You've been speaking to the Minister currently responsible for drug policy, Eleanor Whitman.
Well, I'm here in the East End of Glasgow. I'm just next to a kind of industrial building here, and this is where the Scottish Government's drugs minister, the latest one, there's been a revolving door of ministers over the course of the last number of years, and questioning her. I think it's trying to straddle that line between not claiming that this is a victory today, but clearly trying to suggest that the direction of travel looks positive, or more positive than it has been.
I think we need to recognise that there has been a significant reduction in the number of deaths this year, but there's no getting away from the fact that people are still dying, and these deaths are preventable, and that's why we have to work across services and a whole government approach, but also a whole local government approach and a whole community approach to recognise that these are our people that we need to support to get them into those protective services.
So I think there was a recognition that this is not good enough. The government ministers trying to say they're ploughing in a lot of cash, but when I put it to the minister particularly around residential rehab beds, which is being held up as the holy grail in all of this by some within government right now, there are not enough, but she didn't seem to have an answer for that as well.
We cannot report on drug deaths and drug misuse in Scotland without actually speaking to drug addicts themselves. And to that end, you've been to Dundee, Connor, to the Council Estates, the schemes, as we call them, back in Scotland.
It's a really heartbreaking reality of the front line of this epidemic here in Scotland. Life after life being lost through decades of substance abuse, but also they would suggest a lack of help, whether it be from the agencies involved. And yeah, we went to the Lochee estate, which locals described as one of the most dangerous postcodes, and that is where we met many a person who told us how quickly it is to get drugs. You can get 25 street Valium tablets, which are 4 times as strong as the prescription Valium tablets that you would get from the pharmacy. You can get that in a matter of minutes with one text. It costs you a tenner, same price as a cheap bottle of vodka, and that shows the problem, because people are stuck in this stubborn cycle of problematic drug use. There's another issue where our presence on that estate was becoming a problem. We were approached by a dealer who, under no certain terms, told us our presence was not welcome there, and politely, I would suggest, asked us to leave.
Take us through some of the people that you spoke to. There was one chap, Willie, a veteran, who had lost his leg through drug use, whose story, I have to admit, has remained with me since I saw it.
Gangrene set a bit in that quick. So I had to take my leg off above the knee.
How much heroin were you taking in order for that to happen to your leg? Just give me a sense as to...
A half gram. £15 bag.
How difficult is life for you right now?
Really difficult,
There's another man, Jesse, just round the corner from where we met Willie, and he again addicted to heroin and talks about how crack cocaine and street benzos, street Valium is gripping the city. It's a dangerous time to be living in the drugs world. We met another woman who, she was staggering down the street. She was telling us that she's a mum herself, and she'd come across a dangerous situation with a dealer. It was unclear if she owed him money or whatever, and she had massive open wounds all over her legs, and I asked what happened, and she said she had an outstanding drug debt and acid was poured all over her legs. So that is the front line of the epicentre of Scotland's drug death crisis that, yes, has improved in the last 12 months over the latest figures, but is still the worst in Europe.
Connor, many thanks. And so the question remains, why has Scotland historically had higher drug deaths than the rest of Europe, and why the recent, admittedly significant drop? Professor Catriona Matheson is a substance abuse expert from the University of Stirling and was, until 2021, chair of the Scottish Drug Death Task Force. Professor, good to have you on. To what do you attribute this drop in deaths?
Really to the efforts of people and agencies and organisations across the country who got behind the task force's effort to try to work together and use an evidence-based plan to address the problems we faced when we started in 2019 with the Drug Death Task Force.
This multi-agency approach, this joined-up thinking between different groups and individuals is clearly having an effect, but just practically speaking, how does that work?
There was a number of kind of strategic approaches and interventions that we communicated to our local authority areas, our alcohol drug partnerships, as they're called, to work with us all. So those were increasing the provision of naloxone as much as possible. Naloxone is the reversal drug, which works to reverse an opiate-related overdose. So where it's heroin or morphine, methadone, those type of substances, fentanyl, it will work and reverse that overdose. So increasing the naloxone, and other agencies, national as well, like the police and the ambulance service, have really got on board with that too. So that was one strategy. The other was improving our medication-assisted treatment. So that's the treatment for people who have a dependency, a drug dependency, trying to improve our access and get people into treatment as quickly as possible. And the other third thing is when somebody experiences an overdose that requires an ambulance or going to accident and emergency, then they can get a visit or by somebody who provides some harm reduction advice and tries to just provide that kind of wraparound support for them, because having a non-fatal overdose is a predictor of a future fatal overdose. So intervening at that point is crucial.
It does feel like there are an awful lot more pharmaceutical drugs out there on the streets. What are those drugs, and how are they getting into public circulation in such numbers?
There's certainly more drugs. They may be pharmaceutical, but they're not pharmaceutical grade, and that's where the challenge lies. And the illicit market is vast. It's worth huge amounts of money, and it's very hard to control. So the types of drugs we're talking about, I mean, there's cocaine, there's crack cocaine, which people will have heard of. People may have heard of fentanyl, because that's, although it is possibly, it can be used as a prescription drug, it's also, there's an illicit supply. It's not a huge impact in Scotland yet. It has been in North America. But it's what we call a synthetic opioid. So what that means is there's a group of drugs that act in the same way as heroin or morphine, which are our opiate drugs. They act in the same way, but they're made in a lab. So fentanyl is an example, but now we have new substances called nitazines, and that's a group of these synthetic opioids. And they are starting to come through in our drug death figures. They're starting to show up in our toxicology. Obviously, there's multiple layers and reasons why people are in a position where they're taking those drugs, but it's a combination of those multiple substances that kill somebody.
Can we talk then just a little about the reasons behind the level of drug use that there is in Scotland? And historically, there has always been a significant amount of drug use. Is it as simple as saying it is directly linked to poverty and lack of opportunity?
In these latest figures, we see that if you live in the most deprived area of Scotland, you're 16 times more likely than those in the least deprived. So there is undoubtedly a poverty issue. There is also an element probably in the Scottish psyche that's not so easy to pin down, but something about our enjoyment of substances. You know, it would have been alcohol more in the past, and the pattern of that's changed and moved more towards drugs.
To what extent then is the lack of access to treatment an issue in Scotland at the moment?
Our services are improving their accessibility, but it's also, you'll notice the drug deaths are higher in older age groups. And so these are people who have a long history of treatment and engagement and non-engagement with services. They may well be reluctant or less willing to go and seek treatment because they think they're going to be treated in a certain way. And that's where you start to, hear about how people feel stigmatised. So we need cultural change in our services.
Is the Scottish Government able to do all that it wants to do on this particular topic? I mean, decriminalisation is something they've talked about, but of course that's not entirely within their purview.
Decriminalisation, yes, they are saying that they would like to do that, and I do believe that would help. However, there's things that have been done. So we've been able to look at things like police recorded warnings. If people are, say, picked up and have possession of a small amount of substance for their own personal use, that doesn't necessarily mean or lead to to an arrest or a conviction. Whereas in the past, it would have if it was a Class A drug. So some of those changes have been made, and I think we need to recognise that and make sure that, in fact, how it's being implemented, on the streets is where the difference needs to come. There's policy, and then the policy needs to be communicated down to grassroots level and enacted in an appropriate way that isn't stigmatising people and is trying to encourage them into care and support.
In a moment, we'll reflect on Scotland's long association with drug addiction with a man who's both written about it and experienced it firsthand. Now, we've also been speaking to the author and playwright Irvin Welsh, who of course wrote so powerfully about drug use in Edinburgh, his hometown, back in the 1980s. He was standing next to a very busy road in the city centre, so it is a little noisy, but his take on the subject is worth your time, so here it is. Scotland remains one of the countries with the worst drug deaths per population. And why is Scotland like this? Why does Scotland appear to have always been like this? Certainly in my lifetime.
We've always chased the buzz in Scotland, and that's why kind of hard drugs have been a sort of have been pretty much our forte. It's a cultural hang-up, basically, that doesn't fit well into the landscape of poverty and doesn't fit well into the landscape of zero opportunity. I think, it's like On Trainspotting, the reason that this book is still kind of resonating with people now is because it's not a book about drugs. It's not even a book about youth. What it's a book about is what people do when there is no work. And that was the first bunch of people, the industrial working classes, kind of who were taken away from the world of work under Thatcherism and deindustrialisation. And now it's like it's spreading right across society, and it's a big existential question. What do we do without work? And when you have a transformation in the society, like when we moved from, say, feudalism to capitalism, you had a disease associated with that. You had the Black Death, as a result of people kind of being squashed together in confined spaces and the insanitary conditions. And now you're moving from capitalism into conceptualism, into a world where we can't monetize anything. We're moving out of paid work. So people are asking, what are we here for? What is our future? We're being replaced by AI and robots, and what is the future of us as people? Are we redundant? And that's what are we redundant as human beings? And that's what kind of people are asking. People have been asking that of themselves subconsciously. And the plague this time is drugs. It's the attendant plague. It's like they work as a painkiller. They work as a sort of a distraction from the reality. So they operate on all levels, and they get into that gap, and the gap that's created by the end of work.
Irvin, to steal a line from Trainspotting itself, drugs are changing, aren't they? I mean, once you had heroin, cocaine, speed, now you've got benzodiazepams, the synthetic opiates like fentanyl, the more pharmaceutical prescription drugs. All that's going to be having an effect as well.
We live in a kind of pharmacological society, basically. All our medicine now is dominated by big pharma. The idea that you take something for your psychological pain, your depression or your anxiety is just ingrained in the system. I can't keep up with what is actually out there now. And it's changing so quickly, and people are able to bootleg and to copy and to augment these drugs and to make them into these kind of potentially lethal cocktails.
Do you see a future for Scotland where decriminalisation takes place, where drugs are more mainstream, but they're handled in a rather more adult way than it seems that we're doing at the moment?
I would love to see it. We're doing variations of the same thing we've always done, and it hasn't worked. It isn't working now. And the interesting thing about it is it's like we don't make these changes, and politicians don't make these changes because they're not bothered about drug deaths. All they're bothered about is a circus where they can point fingers at each other and blame each other for drug deaths. If you actually change things, then that puts them in the position of having to be accountable for that change. And there's still going to be drug deaths, but probably not to the same level, but any drug deaths, people will start pointing the fingers at them. So they don't want to stick their head above the parapet. They much rather manage an unworkable status quo. And that's the kind of metaphor for our life on this planet.
Just a final thought from you, though, Professor Matheson. What hope is there that this downwards trajectory in terms of deaths continues when, on the one hand, you've got the Scottish Government talking about decriminalisation, safe consumption in treatment centres. On the other, you have the Home Secretary, Suella Braverman, claiming that solution, it lies in tougher laws, not softer ones.
Some of the issues there are with these synthetic opioids coming into the country. We know that that is being affected by the heroin crops in Afghanistan being changed, and so there's alternatives now flooding the market. So the international market needs to be addressed. However, in Scotland, we need to be able to do more, and there is more that we can do. I think these figures show that the work done to date has started to have an impact, and we could do more, and we could do more by investing in our local services and trying to support people that way. Other things that have helped are, for example, surveillance systems. So by that I mean Public Health Scotland now has what we call radar. It's a way of just trying to find out quickly through testing and communication, for example, with police and toxicology units, what drugs are coming through.
In Scotland, isn't it likely that we will continue to be, if not at the top of the league table, then certainly in the running for first place when it comes to drug-related deaths?
I think other countries in the UK will catch up, the gap will lessen, but unfortunately that is the case. For Scottish Government policy could make a big difference is looking at the future generation and preventing them coming into substance use. At the moment, we're traumatising a new generation of people who are losing parents and siblings to drug deaths, and we must act at that level. So I would be saying to our policymakers, think about that, start to target your efforts now at that area to prevent the next generation. If we can't control the markets, which is a concern, then we need to work with people to not get into taking them in the first place.
And that's your lot for this edition of The Daily. We'll be back again tomorrow.